Hello, I'm Katie Thompson, and I'm the lead inpatient physical therapist here at Henry County Medical Center, and I'm here to talk to you today about physical therapy after you have your hip or knee replaced while you're in the hospital. We will see you first on the afternoon after you have surgery or on the morning after surgery, depending on what time you get back to your room. While you're here in the hospital, you will have therapy 2 times every day, one after breakfast and once after lunch. For your afternoon physical therapy session, you'll be brought down to our rehabilitation gym where you'll get to exercise with other patients who have had their hips or knees replaced as well. While you're in the gym, we'll be performing stairs and therapeutic exercise to get you strong enough to either go home or to rehab. Since you're not sick here in the hospital, you're a healthy patient, we strongly recommend that you sit up in a chair most of the day while you're here and move about your room with the assistance of nursing or some of your family. Since you will be walking out in the halls and coming down to our gym, we strongly recommend you bring a loose-fitting pair of shorts and a loose-fitting top, either button front or t-shirt. If you're having your knee replaced, you'll be on one of our machines called a CPM, which stands for Continuous Passive Motion. You'll be in this machine 4 hours a day total, 2 hours in the morning and then 2 hours in the evening. This machine will slowly bend and straighten your knee throughout that time. When you're walking around in our hallways, you'll be walking with a walker, usually with wheels, and that's just to help take some weight off your sore leg and help with your balance. Now, if you are having the knee replaced, this is that machine, the CPM. And this is what it's going to do to you for those couple of days that you're here in the hospital. The first day, you will start bending at 60 degrees, and then your doctor's protocol tells us to take it up 10 degrees each day thereafter. Once we start the machine, you'll be on the machine on your own, and your nurse will remove it 2 hours after it's initially started. Once the machine is started, it will not bend further or go faster, so it will just run its program for the duration of that 2 hours. That machine right there is bending to 70 degrees, and then it will extend all the way back straight. The next thing I would like to talk to you about are some exercises that we will do here in the hospital and some we recommend you do at home before you come into the hospital. I do want to say that if you do these exercises at home and they increase your pain at all, please discontinue that exercise and do not start it again until after your surgery. The first few exercises are some that we're going to do while you're here in the hospital. The first one is one called ankle pumps. This is one you need to do frequently while you're here as it prevents blood clots, and it's just pumping your feet back and forth. I tell patients that this is a good one to do while you're in the bed. Every time a commercial comes on, you should be pumping your ankles. The second exercise is what's called a quad set. On the leg you're going to have surgery on, you are going to just tighten up that quadriceps muscle, pushing your knee flat into a mat or the bed. The next exercise is a glute set, and it's one where you're going to simply tighten your buttocks muscles, squeezing your butt cheeks together. All of these exercises we recommend you do 20 of them and do 2 sets of each one. The next exercise is what we call hip ab or adduction, and it's one where you are going to bend up your good leg to support your back, and you're going to bring your leg out to the side and back to the middle. If you're having a hip replaced and you're going to have hip precautions, after surgery, this is one that we will put something in between your legs so you can't break those precautions. The next exercise is what's called a heel slide, and it's simply where you can bend up your good leg and then you will slide the heel of the leg you're having surgery on up along the surface and back down. The next exercise is one called a short arc quad. It's one where we will put a little towel roll or a pillow underneath the bad leg. I'll use my leg as an example. And then you simply lift up your foot, straightening out your leg. And then another variation of that exercise is what's called a long arc quad, where you'll be sitting up on the side of your bed or in a chair with that same leg, and you will kick your leg through that entire range of motion. The next exercise is one we call a straight leg raise. It's again where you will bend up your good leg to give you some support for your back, and then you will just simply lift your operated leg straight up off the surface, but keeping that leg straight throughout the entire range. And this next exercise is what we call a mini squat. It's really good, especially if you're having a hip replaced. You can either hold on to a chair or a countertop at home, and you will simply squat down and back up. All of the exercises I have mentioned before are some that you will do here in our rehabilitation gym. The next few exercises you'll find in your guidebook along with these previous exercises, and those are some that we want you to do before you come into the hospital to prepare your body for the strength it's going to need to get better afterwards. One of the ones that we have you do, which is really good for the men, is a hamstring stretch. And all we really want you to do is kind of lean forward toward your operated leg, keeping your knee straight, and get a good stretch right here at the back of the thigh. You're going to want to hold that for about 20 seconds, and you can do 2 to 5 of those depending on how tight your hamstrings are. Another really good one is a knee extension stretch. It's a really, really good one if you're having your knee replaced. For this stretch, you'll want to keep this leg straight, but pop your ankle up on a higher surface. If you're laying in the bed, you can use a pillow or a coffee can, a towel roll, anything to get that ankle higher, and you can put a small weight across your knee to get it to go flat. You can hold this one the same amount as your hamstring stretch, about 20 to 30 seconds, and repeat this 2 to 5 times. And then our last exercise, which is going to be very, very important after surgery, is called an armchair push-up. And it's one where you are simply going to sit in a chair that has some arms for support. Push down with both arms and lift your buttocks up off the surface. This exercise will be one that will help you use your walker and get up from surfaces after surgery, as one of your legs won't be as strong as the other one. Now, for those patients that are having their hips replaced, there are 3 things that you're not allowed to do after your surgery. You cannot cross your legs, you cannot let the leg you had operated on turn inward, and you cannot bend at the hips past 90 degrees. Not all of you that are having hip replacements will have these precautions, but as a safe bet, it's always a good idea to know these precautions before you come into the hospital. There will be an illustrated picture of these inside your guidebook.